Hello, everybody. Hopefully everybody's moving forward and getting their vaccines. I'd like to open the meeting if that's possible. My name is Tony Storis. I am the chair of the Board of Health of Nashua. I am at home by myself, except for the dog sleeping at my feet. Other than that, next up.
Stephanie Wolf Rosenblum, at
Hi,
home.
Steph.
I can hear you. I am alone.
Hi, Stephanie.
Hello.
Welcome back.
Thank you.
Chuck, are you out there?
You're muted, Chuck.
Oh, sorry. Hi, Chuck Capetta at home. No one else is here. And all that. Thank you.
Hi, Chuck.
Good afternoon, boss.
Boss, oh geez. I doubt that very much. Anyway, is that all we need, Bobby? Just the key players, and then no one else has to.
And then we'll just do the opening. You know that we're having this meeting scheduled by Zoom. We're meeting via this method due to the governor's stay-at-home, safer at home order, which is still in place, and the meeting ID is 863-9978-9686 with a passcode of 271193. The Zoom meeting can be accessed by telephone at 1-646-876-9929. And if anyone has any trouble with the audio or accessing the Zoom link, they need to dial 603-821-2049. The meeting is also recorded and will be accessed on TV, Access TV. And that's it.
Sounds good. I'd like to start out with the director's report. Bobby, you're first batter up.
All right, thank you. And it's good to see everyone is there, and welcome back. Dr. Wolf Rosenblum from your travels. So just in our overview for the work that we've been doing, we continue to work, of course, with a focus on COVID and our response. We are still working, as a whole with our staff participating across all of the activities, which includes the disease investigation led by our community health nurses, with contact monitoring supported by other staff from the other departments. We continue to have a hotline that's staffed by staff across all of our departments as well. We continue with our testing clinics, and now we've moved into the phase of vaccination, which is another mitigation strategy to stop the spread of infection. As the public health chief strategist, we continue to work with our partnering organizations to address COVID response collaboratively. We continue to provide situational updates on a weekly basis to the joint partners that includes our hospitals, community-based health centers, police and fire on that call with the mayor's office, as well as mental health, home health and hospice, and several of our nursing homes. Based on what we have been seeing, our numbers look like they're going down, which is good. And Angela will give an update on that in her report. Initiatives that I've been working on over the past, it's not the quarter this time, it should just be for the past month, include receiving $20,000 from Harvard Pilgrim. They sent some money in response to addressing, making sure there's awareness and education for our Black, Indigenous, and other people of color populations based on the data that we've seen with COVID in New Hampshire and information that came back from the governor's health equity report to prioritize that population group to reduce some of the disproportionality that we're seeing with COVID, with illness and hospitalization and with deaths. And so we were awarded $20,000 to focus primarily on decreasing vaccine hesitancy with that population group. We will have to set up a fiscal agent because that will not, when Harvard Pilgrim gives up their funding, it goes to nonprofit organizations with a 501c3 status. And I have reached out to the Southern New Hampshire AHAC, which focuses on health education for, healthcare providers. And so they'll be our fiscal agent for that. We've also received $100,000 in funding for FEMA. And what that means is that we have the work or activities that we're going to do specifically to the vaccination clinic will be fully 100% reimbursed by FEMA. The city does have to upfront the, the dollar initially, but 100% reimbursement will come back from FEMA. And the goal of that is to get more staffing, clinical staffing on for vaccinations. And then some of the funds will also be used to support other things that have to go along with the clinic, with marketing and again, getting the word out as well. We've been meeting as, again, in response to the vaccinations. A lot of things have now shifted to vaccination focus. And so there've been plenty of meetings with Homeland Security, Department of Public Health, and DHHS around the vaccination efforts. Things are moving really quickly, very swiftly. We've gone from 1A to 2B. They're rolling out the 10% vaccination allocation, which includes focusing on racial and ethnic minorities, folks who have lower income, individuals who have difficulty accessing testing sites because of transportation. And so all those things are going on at once. Vaccination continues to come into the region from the state. The numbers of vaccinations or vaccine is starting to increase. And they just announced that we're also going to now start allowing for our pharmacies to do vaccinations. And I believe it's Walgreens. That's the first one that's going to start picking that up. Had the opportunity to work with Southern Solutions to plan a vaccine clinic with them. So all of our partner work, as you're going to hear from some of the reports, has been going extremely well. There have been some hiccups, as you guys have probably heard, with vaccination appointments being canceled and rescheduled because of VAMS and how VAMS works. But they're trying to really work really hard on that. Perry Plummer, who's at Homeland Security, has been the face, making sure that all of the glitches with that are taken care of. And so that's an ongoing battle in itself. I still continue to participate on the Public Health Services Improvement Council that's working on the state health assessment, and that we're at the phase of developing the survey, statewide survey. I was able to use the Community Division of Public Health and Community Services survey tool so that they could get some ideas of how to make sure that the tool that is developed does use an equity lens and make sure that it is something that can be used to get feedback from all the population groups, which has been very interesting work. And we've been meeting twice a week sometimes with that group. I continue to participate on the governor's Equity Task Force response team. So we're looking at things that have been implemented and plan to put together a report based on some of the work that the members, have been doing in the state. And a lot of the things that we've been doing at the division fall under some of those implementation phases that are expected. Been participating on the Board of Ed meeting. So they made a nice announcement about moving into hybrid as they had designed in their plan. So that's looking like that's going to move forward. Been working with the CHA, and you're going to hear more from that from Angela. And then we've been planning, Patty Crooker, who is our Public Health Network Services coordinator, has taken the lead with getting our vaccination clinics scheduled in the community, as well as continuing to support those in 1A and in 1B getting vaccinated. So there's quite a bit, as you all know, there's a flurry of work that's going on. And then we just try to make sure that we stay on top of it. Our staffing is still holding steady. We still have 37. No one's left us as of yet. Woo, a month has passed and no one's left. Woo-hoo. We have to celebrate those little things. And in fact, we have interviewed our final position, a community health worker. We found a candidate that we think will be good to bring onto our team, does have experience working as a community health worker in Manchester, knows Nashua because also worked in Nashua for one of our recovery centers. And so he's excited about that. What else? We had a legislative breakfast that went over very well, and hopefully either Nicole or Angela will talk about that in their report. And we have students that are coming back on board. For our staff development and our workforce development plan, we sit in a place to try and provide as much opportunity for nursing students, public health students, even high school students to be with us. And so we have our MOUs that are starting to come in from the nursing schools, from Riviera, St. A's, and Nashua Community College. And then we also have another medical student who will be starting with us on the 15th. And what else? And that's it. And then I've done numerous press conferences or had some media presence. And one of that was fun. I was on 95 Jammin' radio last week. So that was fun. I got to get on there. I got cut off, but I still was on there for about 20, 30 seconds, maybe a minute or two. But that was fun. But that's my report. Lots of things going on. The team is still working really, really hard, and you're going to hear that from some of the reports. Our workload has not ebbed at any point in time that I've seen. We just continue to do more. And I think with having the community health workers on, it helps support some of that work, balance out a little bit, across some of the DI work especially. But now that we're ramping up with the vaccine stuff, that just adds another layer on. And so far our division is doing very, very well with those efforts as well. That's it. I don't know if people have any questions, but that's my report.
Thank you, Bobby. Any questions out there?
Yes, Stephanie. First of all, kudos to everyone. This is a tremendous body of work during the most challenging of times, and it's commendable in so many respects. I have 3 questions/statements, which could be answered now if appropriate, or I refer to the appropriate staff member to address as part of their reports. One is the availability of PPE for workers, for our staff, as well as for the public. I know that you mentioned a lot of different potential uses of those funds, which you so skillfully obtained, but I would like to be reassured that the staff on the front lines have PPE, and also that any community members that are unable to access masks have a source to go to. The second one, and I'll just state them quickly and then I'll leave it to the group, is that you mentioned Walgreens. I am very concerned based on my own experience. Having just returned, I'm having trouble getting vaccinated, and trying to get registered with Walgreens has taken hours and an online chat. And while I was online chatting with this individual, I said, for those who are not computer savvy or don't have access to you register and you create an account, and then they certify it, and then you get the registration back and approved. What number do they call? And they said, there is no number. You have to have access to computers. And I tell you, it was worse than VAMS. So I think that that's going to need to be acknowledged and recognized. So those are my basic points.
Okay, thank you.
Okay.
As far as, did you want me to answer that, Tony? Or I think there's several folks that can probably answer some of those too.
I was going to say our task force on Monday actually addresses a lot of those things every week. If there's somebody who'd like to take control of the questions, fine with me. Go ahead.
Yeah, so I can start, and I think that others can also add in. As far as PPE, most of the organizations, including our health department, we're doing well with PPE. We haven't had any issues with access, and in fact, we still have quite a bit in our storage house over at Gilson Road. We continue to wear full PPE at our testing clinics as appropriate for whichever role the staff is, engaged in. And so if they're doing the actual collection of the samples, they're in full PPE. If they're doing the registration inside of the building, then they have the appropriate protective gear on if they're outside with the cars. Again, it depends on what they're doing. So we haven't had any issues with PPE. And as Dr. Sturz mentioned, when we hear from our joint partners, folks are doing well with PPE across the board, with the hospitals, all of the agencies, the nursing homes. As far as access to masks, we have a number of organizations that are in a community. For instance, United Way has been very instrumental in making sure that masks are available. We also, when we have the opportunity to also distribute masks, and I know that Nicole has placed a nice hefty order of masks for us to be able to distribute when we're doing some of these, not just the testing clinics, but when we're doing the vaccination clinics as well. The question about Walgreens, I can't speak to their system. We just learned that they were going to be, and that they had gotten vaccine in, and that they will be in New Hampshire, be giving out a certain number of doses. That's going to up us by, I think they said over 3,000, I think. Flavia, I think you were on the call yesterday. They mentioned a certain number that will be going through Walgreens. As far as their system, I do not know if the state has anything to do with that system, if it's independent. I know that they are working through VAMS to make sure that that works as well as it can until the state gets its system set up. Flavia, do you have any more that you can add to that with regards to answering that piece?
Flavia was not on the regional public health network call.
Okay. And I'm looking, I don't think, Jane, were you on that call yesterday?
Well, I'm taking my information from the press conference yesterday that the governor held. And my impression is that the list, they're providing the list to Walgreens, and that the Walgreens people are going to be contacting the people that are registered. So for example, if you're too far out, if you're April or March, they're going to give them, you contact these 100 people and get them in for a vaccine earlier. So I don't know if there's really a registration process, and that could be why you had some trouble. But that's what they reported yesterday, that the state would be providing the list to Walgreens.
So they can get people vaccinated sooner than later if they're scheduled their second.
Right, as a way to take some time off of the far out on VAMS and the fixed sites.
Yeah. Okay, thank you, Jane.
Bobby, excuse me, can you pull down the screen? Right now I have the agenda or actually your report up there. Can on my camera or on my screen, can we go to the participants?
Yeah, Fulkia is handling the screen. So Fulkia, do you want to stop your screen share?
Yeah, I've got everything printed out, so I really don't need it. I'd rather see the faces of the participants.
Okay, so you want me to stop sharing the screen?
Yes.
Just for me.
Well, it'll stop for everybody, Tony.
Oh, that's what I was asking. Well, if the other people need it up to have a roadmap of what we're talking about, then leave it up. I thought you could do it individually. I'm sorry.
So should I go ahead and take it off or no?
No, leave it as is. I'm sorry.
Okay, that's
Thank you. I have a couple comments. Currently, the high school is on the hybrid system. I was over there this morning. Parking lot's full, and the kids are in classes. I also got my second shot this morning, and I have to say, met a lot of National Guards. Is Nicole on by any chance?
Yes.
Nicole, they recognized the dog, but they didn't recognize me. So I don't know what that has to say about me. But today, Hudson Fire is helping out the Air National Guard. Nice people. A lot of young guys. You guys should hit out over there. Okay. Next up, any other questions for Bobby?
Well, Bob, can I ask a question?
Go for it, Chuck.
Yes. So I guess, Bobby, how do you reconcile the grant that you got from Harvard Pilgrim and the commercial-based Walgreens? That just seems a kind of a dichotomy of interest there. So are those 3,000 vaccines that are going to Walgreens now going to be subtracted from the total that are going to the state and therefore less to the people that really need them, or don't, like Stephanie just said, don't have access to computer or don't have the savviness to hold 9 hours on a phone call? I just think that's a little competition there.
Yeah, I think the vaccine that's coming in for Walgreens is in it, so that's additional vaccine that's coming into the state.
Okay. Because I too have problems with Walgreens as a commercial entity, and they always seem to get the flu vaccine every year before we in the offices get them, and I just think there's just some discussion of that at some level. But no, I applaud all your efforts, and it's amazing. And the staff members from our office in Dartmouth that have volunteered over at the high school have enjoyed going over, and you want to run a very well Army-like routine over there. It's clockwork, and they got in, got out, and were treated just extraordinary. So I shout out to everybody there. Thank you.
That is true. Any other questions, please?
I have a question.
Please.
Elizabeth Liu. Hi. Can you hear me?
Loud.
Can everyone hear me?
Loud and
Yes.
clear.
Okay. I apologize if this is a basic question. I'm not I haven't been able to register yet, but but I thought I understood, and so I haven't looked closely at the process. But something Stephanie said surprised me. I was under the impression that that if you want the vaccine, you've got to go to the state of New Hampshire and get on a list. Now, but Stephanie said that she went directly to Walgreens to try to register. So did I misunderstand something? That's all.
So this is Stephanie. Let me address that. I signed in VAMS, and I've got an appointment at the end of April. In the meantime, there are a lot of, I get, prescriptions at various pharmacies, so they represent that if you register with them, that they may have appointments, and you can just keep checking back. At no time was what was just described a part of that. And in fact, this morning, when I was in my 4 a.m. jet lag, I did a chat with a representative of Walgreens, and they said, oh yeah, you go here and you register, and you should just keep checking back for appointments. So, it may be different in different states, but to me, it's a misrepresentation.
Okay, thank you, Stephanie. You didn't mean that I misrepresented what you said, did you? I'm sorry if you...
No, I'm saying...
Okay, all right.
No, that Walgreens is misrepresenting. I'm sorry, I did not mean to imply that.
No.
You guys are great advocates for all of the community.
Thank you. That's all. I'm all set.
Dr. Sturz, are you on mute?
How did you know? Been talking to myself. Are there any other questions? Seeing none, literally I cannot see any people, so I'd like to move on to the community health report, please.
Okay, getting myself on mute. Hello, everyone. I'm Flavia Martin. Kim
Hi,
is
Flavia.
unable to be with us today, so I'll provide a report. Some of the department highlights: the major focus of time and resources has been on COVID-19 mitigation strategy. We continue to lead with disease investigation and contact monitoring. We made some modifications to disease investigation operating procedures in anticipation of the spike that we saw coming up. We had to kind of shift things around a little bit in order to reach the majority of people with the highest risks. And as we started to see the case counts coming down, we also made some modification. We expanded certain process of what we were doing in order to continue to capture the highest risk population. We've been assisting with weekly COVID-19 testing clinics and the hotline calls, vaccine strategic planning internally, and also with DHHS and local partners. We rolled out our first successful COVID vaccine clinic at the end of January. And Kim is heavily participating on onboarding of clinical vaccine volunteers through online and live training and orientation. A few other highlights: we restarted weekly in-person STD, HIV, hepatitis C clinic with a nurse practitioner and our nurses and community health workers in partnership with Lamprey Healthcare. In terms of our other programs, SANA program services continues to be ongoing with community health workers doing outreach, going to Layton House. They recently participated in the yearly count of homeless individuals. Our immunization program, we had 11 non-COVID immunization clinics in the month of January and 6 COVID-19 vaccination clinics. STD program, I mentioned that the restart of the weekly clinics at Lamprey, in addition to the Wednesday library clinic. The communicable disease program, we investigated 1,748 cases in the month of January. The case count went down slightly, but we did see a bigger decrease in the outbreaks and congregate setting investigations that we did, which is, it's good. It's, coming from where we were a couple of months ago. Things to mention upcoming, we've been working very involved with the school administrators to develop contact tracing and notification plans in preparation to bringing on more students in hybrid modes starting next week. And I think that's about it for highlights. If anyone has any questions, I can answer.
Thank you, Flavia. Anybody have any questions?
Oh, the only other thing that I wanted to mention is that coming up in February, we've done, I think for the past 3 years, our Valentine's Day event for the STD clinic. We're going to be doing that again this year. It's not going to be set up as in the past, but we'll be promoting that with gift cards and different locations and sites that people can attend over the course of a few days. That's it.
Okay, thank you.
I had a quick question.
Please.
Just a quick question about the warming stations on weekends. I don't know if this is the time to ask about this, but are there any, does the city provide any warming stations for people who are in shelters or not in sheltered over the weekend?
So, Dr. Sturz, if you wanted me to answer
Yes,
that.
that's fine.
So Alderwoman Liu, so we have been having some conversations. We just had a meeting today, and there's going to be a discussion about this at the meeting on Thursday, substantial housing meeting to talk about this. Usually with the warming stations, that's usually provided in the community by some of our community partners. Right now, the National Soup Kitchen provides a warming station during the week. I'm not sure if it is open on the weekends. Other places that have traditionally provided the opportunity for that has been the library and the malls, but due to COVID, those opportunities have not been open to the public because, again, of not wanting to have numbers of people, in an area and creating a situation for, COVID exposure or spread of illness. And so we do have a small group met this morning, and there will be continuation of that conversation of making plans at the meeting on Thursday. So Alderman Lopez has reached out to the National Soup Kitchen, some of the other shelter agencies, as well as the Nashua Area Interfaith Council on what could possibly be put in place to provide warming station opportunity for individuals that do not have housing or cannot get into motels. So that conversation is an ongoing one.
Thank you. I was invited to that meeting. I'm on the substantial committee, so I guess it was kind of an early. Thank you.
Yeah, it's a new item added to that agenda.
Okay. Any other questions? Seeing none. The emergency preparedness report, I didn't get one of those.
So I know, you know what I think happened is that the agenda wasn't updated based on the reports that came in. So that just wasn't taken off, but you'll hear a nice report at the next board meeting.
Okay, thank you very much. I believe epidemiology report.
Good morning. So I can go ahead and get started with a COVID-19 update. So as of today, we have 107 million cases worldwide. 27.1 million of those are in the US, with 468,000 US deaths. In regards to community level transmission here in Nashua, we are currently exceeding 1 out of 3 indicators that push us into substantial transmission. So over the past 14 days, we've had 471.1 new cases per 100,000 people, which is down about 250 standardized cases compared to last week. This number has been trending down for the past 3 weeks. Then we're considered moderate in the percent positivity category. So in the past week, there has been 369 tests conducted on average each day in Nashua, and 26 of those tests have been positive each day, which gives us a percent positivity rate of 7.2%. This number has been considered moderate for the past 13 days. And then we're considered minimal in regards to new hospitalizations. In the past 2 weeks, we've had 2.2 new hospitalizations per 100,000 people. In regards to our case activity, there are currently 6,023 cumulative cases in Nashua. Of those cases, approximately 240 are currently active and infectious. We've had 1 additional death in Nashua since last Monday for 74 total deaths and a case fatality rate of 1.2%. Our hospitalization rate in Nashua is at 1.9% compared to the state's rate of 1.5%. And then in regards to the state as a whole, there's been a total of 68,918 cumulative cases in New Hampshire, 3,170 of which are currently active. And then case activity in Massachusetts and across the country continues to decline. Massachusetts currently has approximately 55,000 active cases, and they're now seeing less than 2,000 new cases a day. So in regards to non-COVID activities, with this bit of decrease in cases and COVID activities, we've been able to shift back into some of our regular duties. So we have several strategic initiatives that are in the works. The first is our community health assessment, which was just opened up for public comment yesterday. So we're very excited to get this published and wrap up that work and use it to inform the development of our community health improvement plan. The exciting thing about this CHA is that it's on our data dashboard. So I'll be working on keeping it up to date as new data comes in. And then we have our performance management and quality improvement projects. So for this, we had originally decided to work on 4 separate departmental projects, but we switched our focus this past quarter to a division-wide project reflecting our work on COVID-19 and health equity. So we've already done the plan and do sections of the project, as we have spent a significant amount of time as a division strategically planning how to increase testing, vaccination, and COVID education in our Black, Indigenous, and other peoples of color communities. And we're now in the study piece where we're pulling together data and trying to document our impact and show the impact of what we've done so far. We're also working on our strategic plan to guide us for the next 5 years. And part of that strategic plan is a strengths, weaknesses, opportunities, and threats assessment that we conducted in January. The cool thing about this was that we did the same SWOT back in February 2020. So we now have a unique look at how our division changed and our values changed, and we kind of adapted pre-pandemic, post-pandemic. And then we have our community health improvement plan, which is being spearheaded by Jane and Bob. But so in regards to EPI support for that CHIP, I created a data interpretation and summary document for the 2020 CHA, which will be provided to community partners along with a presentation on each CHA chapter. Then the partners will be asked to prioritize each health area and identify what is most pressing for our region to work on collectively. And then I've also been working closely with the ACEs and Maternal Child Health Work Group to develop a series of focus group questions and stakeholder surveys to guide where this priority area is headed in this next CHIP cycle. And that's all I have for my report.
Thank you, Angela. Any questions from any of the members?
I kind of have one.
Go ahead, Tom.
I'm not sure exactly what category this falls under, but in terms of public health response and in terms of phasing, it looks like we're moving more towards vaccination and public engagement versus earlier where, I mean, especially towards the end of last year, where we're looking more at like hazard mitigation, I guess you could say. So in the fall, as we're all definitely aware, there was the feeling that we needed to reduce access to risk behaviors in restaurants, you know, with the curfew and everything. That's still sitting on the Board of Aldermen's agenda as a tabled motion. And I kind of left it there because I felt like it would be good to remind people over the holidays of the risk. But I think that's actually going to start being counterproductive, having it on the top of every agenda at this point, because number one, there's virtually no political interest in actually enforcing a curfew at this point. So anything sitting on the agenda like that is not going to pass. But at this point, it's just sort of, I think, it's just going to start building negativity towards public health efforts to vaccinate and all that kind of stuff. So do we feel like it still needs to be there, or can we focus more on public engagement and more positive steps?
Discussion?
I guess as a counterpoint to that, it might be politically a little bit more effective in terms of building advocacy and in terms of public health outreach to focus more on making sure that restaurant workers are identified as a population that we want to deliberately make sure can have access to vaccine when that becomes available, like clinics for restaurant workers at times when restaurant workers can go. Rather than looking at the stick, maybe try focusing more on the carrot.
I hear you, Tom.
So this
So,
is, and I think may I, Tony?
Go ahead. Go ahead.
Emotions were so charged over the holidays that it was hard to proceed. And for me, I'll speak just for myself, if it wasn't a compelling argument over the successive Thanksgiving, Christmas, New Year's holiday, I don't think there's an appetite for doing it, especially in an environment where Massachusetts has opened up and taken away the curfew and where vaccines are now available. So we're arguably not in as bad of a situation as we were 6 weeks ago. However, I think it's pretty easy to demonstrate that there were spikes associated with holiday gatherings and super spreader events. We have several potential super spreader events coming up over the next 4 months or so. We've got St. Patty's Day, we've got Easter/Passover, and we have Memorial Day. So I think it would be a mistake to drop the concept entirely, that we need to do something, but I also have no appetite, nor do I think anybody in the community does, for anything as a curfew. So I would propose that we talk about a pivot to the engagement we talked about before, and that I would still like to see a meeting in advance of each of the holidays, even if it's a mega Zoom call, to address mitigation opportunities before these major events as to what people can reasonably do and what steps they can take and how they can educate both their staff as well as their patrons. So I don't know how one accomplishes that pivot, but I would highly recommend and support that we use the pivot as a lever to try to get the engagement that we wanted over the holidays.
So Dr. Storrs, are you still not able to see hands?
I see your hand.
Oh.
There's only, the way this is set up is the document is here, and then in the right-hand corner is one face, the person who's,
Okay.
So,
So
I don't know if
Fouquet,
you can do on
you
my
stop-
part.
Yeah, Fouquet, can you stop the screen share? And then that way, Dr. Sturge, you'll be able to see
Okay.
all the hands. Yeah.
I would also just add that above the images that you do see along the top,
Here we go.
once you move, okay, good. Because you can basically set up a gallery view instead of a speaker view. So you don't have that big giant
ga-
picture, you see them all. Okay.
Yeah, I had it set up as gallery, but I guess whatever the screen thing was overriding it. I just want to be able to see somebody who's got their hand waving, make sure that we don't
You need
miss
to break
anybody.
it
Trying to be fair and equitable. Tom, can I ask you a question? Not to get away from Stephanie's, but I want to ask you a question on procedure. What if you remove that pending legislation that needs to be discussed and passed? How hard is it to get it back in?
Not. So there's two things. First, you could leave that there and then try to amend it, but I think that exact piece of legislation has become a poison pill. So no one's going to support that because they want to say, I didn't support that.
Right.
If you ever want legislation put forward, I can propose it and get it into the next meeting as long as I have at least a week's lead time. And then there's also some validity to checking and seeing what the Board of Health's own authority is with regards to that kind of stuff, because there are some things you don't necessarily need aldermanic approval for. Unless you're creating a new law, I don't think you need that. So it's always worth checking to see with legal whether you need our permission in the first place, because if you need our permission, then suddenly you have to brief 14 people in on it and in public basically make the case that they are now empowered to make decisions over, regardless of their background or level of familiarity with that. So I think that there's a lot of areas where having legislative support is useful. I don't know that in a crisis or this kind of scenario, it is. So if you do have something that you think needs to be enforced legislatively, like as a law, then my recommendation would be asking for a joint session in the future where all three of the board members attend and the aldermen are invited to attend as well and convene, and you guys are able to basically present on equal footing rather than having to show up in the public comment section and at no point really being invited to directly speak to an issue. So it's easy to do a legislative piece, but to get it passed effectively and quickly is a little bit more challenging. I don't think if we were looking at the pivoting piece, you necessarily need legislative support, because you could probably look at that as a extension or an expression of being approved for operation by community environmental health. So have them set guidelines for this is what you need in order to participate in outdoor dining or whatever. In addition to saying things like you need social distancing and you need this many seats, you also have to have somebody participate or confirm participation in a briefing before major super spreader events so that we can reopen safely or something along those lines.
I understand what you're saying. I think the other thing, like you said, having that legislation sitting there and being addressed and retabled at every meeting is more like a scab. You know,
it's not pleasant. I think people looking at it are not happy about it on either side, because for everybody who's for it, it's a reminder that we didn't, and we're in the middle of an outbreak that probably was exacerbated by that. And for everybody who was not for it, they're going to be concerned that we're going to try it again or pull it off the table. And
how easy is it for you to pull it off the table without shaking the tree?
To destroy it very easily. I can literally just say move to definitely postpone, and it's gone. Like I don't think. Well,
if there was one alderman out there who's vehemently for it and then gets their legs chopped out from underneath them, that's not a very good political position to
was
be.
the alderman who was vehemently for it. So if I'm the one who says, okay,
You know what,
well,
James?
you say it's not good anymore. Like, yeah.
But can I ask a question?
Who's asking? Oh, Bobby.
Yeah, so it's another like process or parliamentary legislative question. So at the last meeting of the conversation about it, it said that it was tabled. Did it say it was tabled indefinitely? Is that why it's still there? Because I actually thought that it was done and that it was finished. And so tabled indefinitely means it just still sits there on the agenda until you remove it.
So there was a motion for indefinite postponement,
Oh,
which basically
postponement.
would have removed it from the table and said, this is not coming back for the rest of the legislative year. But that was defeated in order of leaving it on the table for an indefinite period. So
You have to address
it's
it at
sitting
some
there
point.
until someone does something to it.
Okay.
Okay,
Which was
Tom,
helpful in some ways for reminding people about risk because it's on every agenda. But I mean, that ship has sailed. Now it's probably not doing that.
yeah, it's kind of a bruise. Stephanie, go ahead.
I don't want to go on record as withdrawing it without replacing it with something. Because the Board of Health made a recommendation. It was neither rejected nor accepted. To the points that have been made, it's kind of a poison pill. I would rather come out with a statement that says, in recognition of the fact that this was not able to be supported, the Board of Health would like to ask that it be, replaced with, what we said about engagement and reminders and education or something.
So
Well,
if you
I
make a
don't think
communication
I don't
with the
think you
board-
need, Tom, excuse me for 1 second. I don't think you can't kind of make something and like stick it on their agenda and leave it there. Okay. And I don't think you need the Board of Aldermen to make that announcement. I think you have it within your advisory role as the Board of Health to make an announcement regarding however we decide to put it together. And correct me if I'm wrong, Tom, you could then ask the Board of Aldermen to support that. Okay. But once you start playing in the legality of it and writing something like that, then you give people a chance of amend what you originally want. Do you want to do that? Do you want to throw that out there and then have people change it on you? Or would you rather have the impact by using the public health department to push this as a spearhead? And that's a question. I'm not making a comment. Tom, I think you were going to say something and I interrupted you. I'm sorry.
Well, I was going to say, you can make the statement either as just a communication to the board that gets, I can read it when I make the motion to postpone it if you want. It will be seen by the Board of Aldermen as a memo relative to that motion expected to be acted on. You can take it one step further if you want, and I can probably, there's ordinances, which are laws, and then there's resolutions. I can ask maybe the mayor to present a resolution saying Nashua remains committed to managing the COVID outbreak. We are looking to reopen in a safe and effective way. We want to protect businesses by making sure there's actual planning and coordination around super spreader events. And that's a resolution that could be presented. I would just put a little bit more thought into how that should be crafted and consult with legal. That's not a law. That's just an announcement.
Right, right. And I think in that respect, you get to control the narrative of the announcement versus the other way. Go ahead, Stephanie.
I was going to ask if Jane would be able to assist us in crafting a message to come out at the March 10th Board of Health, which is just prior to the St. Patrick's Day holiday. And that seems to me like it would be a auspicious time to emphasize concerns, especially since some people who have been vaccinated are letting their guard down.
Okay. Ren?
Good afternoon, everyone. Ren Bodo on Environmental Health. I can state some of the concerns that were addressed here. We were going to address some of these in the Environmental Health section, so I can defer until then if the board wishes, however you would like to handle that.
No, go ahead, Ren. It's fine.
Perfect. Thank you. I believe when Nicole gets to her report next, I'm not sure if they're planning to show you guys the flyer that we've already made for the holiday, but this is something that we have worked with the internal team as we wanted to get an early start on these like drinking holidays, right? Because there are a few that are kind of, on dock. We got St. Patrick's Day, we got Mardi Gras, Cinco de Mayo, we got a whole bunch of holidays. And we were thinking of coming up with something that we could reuse and recycle kind of at each stage. The other thing that we've worked on in the internal team to get to the points that were also raised, trying to pivot to the response phase to the recovery phase, right? So we are at the point now where we can vaccinate, where we kind of know a little bit more. We're entering into this new phase while we're still actively involved in the response phase. So the environmental health team has met multiple times. We have prioritized all of the restaurants that are deemed high risk during these drinking holidays, and we are going to begin the outreach efforts early this year. So we're planning to send our team out there next week, where we will touch base with all of these high risk areas. We will hand out the flyers that we've made. We will reach the public, I believe, through the Constant Contact group, which is managed with Jane and Nicole. And we will reach out to all of the restaurant owners and the managers which are there. At the same time, we are also going to be sending it out to our email group, which is approximately 250 owners and managers of the food service, which we do have, to again begin the conversations early. And we are creating talking points, so as each of our staff are in the field, that they are all covering the same points, so certain things do not get lost, because we want to make sure, again, everybody is really maximizing safety. On another note, to maybe help steer the board on what they're thinking about, I will echo what Flavia said in terms of cases. The reports from restaurants or areas that do hold a food service license has also gone down. So although we have gotten calls and reports of cases, in some places where there's been maybe 3 or 4 cases, the investigation that our team has done has shown that they were not linked within the actual food service area. They were all caught elsewhere outside of work. And this is, again, looking at working schedules, looking who was overlapping, do they hang out outside of work, looking at a whole various factors to find out, where these cases actually started. So we are seeing less and less cases kind of crop up, and we hope that trend kind of moves forward. But we do understand there will be times where there may be peaks, and we're trying to gauge when those areas would be, like I said, especially during these drinking holidays, to reach out and get a head start on that. So that is what our team is currently doing. Thank you.
Thank you, Ren. Any questions? Cheers right back at you, big guy.
I do have a question.
Go ahead, Bobby.
So does that help with what's on the Alderman's agenda every meeting? So Alderman Lopez, so where is it written? Because I didn't see it on the agenda. So is it someplace that we don't see? Or is it just on something that you all see at each meeting? I'm not sure if he's there.
Did we lose Tom?
Tom, you're muted.
Sorry. I was distracted.
Go ahead, Tom.
Well, I was just going to ask if we had, or if it's even possible to look at, there's definitely identified vulnerable populations based on age, health, socioeconomic status, and then there's also exposure. So we looked at first responders as particularly having a high level of exposure. Are we doing that with restaurants? Are we going to have clinics that they can have attend to where they have access?
That's a good question. Can I get out of the cheers to health and go back to the people page. There we go. Thank you. Bobby, Tom has a question about that. And I think it's a good one because it also ties in a little bit with Stephanie is how do we get the message out to the people that need to hear the message? It's one thing to just say it all the time, but Tom's saying, is there going to be any clinics where they can learn or any continuing education where we can educate them, et cetera? Or do we just go in restaurant to restaurant, knock on doors and say, this is our pitch? Bobby, any insight?
So between, the messaging that Nicole is putting out and what Ren just described is basically how we generally get information out to the public. And, other than that, Nicole or Jane, I think that was our major communication that we were going to do. Anything else?
Yeah, I think specifically we're on St. Patrick's Day. It was mainly the outreach from the Environmental Health Department and then putting information out through Access TV, through our newsletter, our social media pages, and just getting that flyer out to our partners in hopes that they'll be able to share that with their clients as well. But I think our biggest way to push that out was through environmental health and being able to provide hard copies of those flyers for them to post at restaurants as well.
Thank you, Nicole. Ren?
Can I just ask a clarifying question to Alderman Lopez? Were you referring to vaccines or outreach?
Tom, you back there?
Yeah, I was talking about vaccinations.
Okay.
So vaccinations for which group? Because there's a lot of information that's going out.
Vaccinations for COVID-19 for people working in restaurants.
So if I may add in, weigh in.
Go ahead,
Okay.
Flavia.
So most restaurant workers will be vaccinated according to their category, whether they fit 1B right now, whether they fit 2A is mostly teachers, but 2B, 3A, 3B. So they will have to get vaccinated according to their age and medical condition category. So I think there's a lot of unknown right now of what this is going to look like come April, May, June, when the majority of the population is going to be getting vaccinated, what we're going to have for clinics at that time. Right now, it's mostly through the National Guard sites. We started doing some clinics ourselves. But once we get through this large majority of people and we're in the, those months, that phase, we don't know yet what the vaccination clinic is going to look like. And I think as we get closer, we'll be better able to plan timing, locations, and the messaging as we get further along. That's all.
Yeah.
Thank you, Flavia.
Sorry, I misunderstood that, Alderman Lopez.
That's okay. I just see a relationship between saying that restaurants are a higher risk of exposure area and then us not making sure that people in that higher risk area that we're asking or have asked in the past to look at a curfew, not making sure they have access in a timely manner. Because if they're not vaccinated and their business has an outbreak, their business closes. So there's definitely incentive for them to work with public health to figure a vaccination plan out for their employees. There's also a need to educate those employees who maybe are already going to be vaccinated as part of an earlier phase, that just because they're vaccinated doesn't mean they're not transporting the disease or the disease, and that they still need to themselves mask even though the kitchen is hot, and make sure that their customers are masking. So I kind of see some complexity there where we should probably, I don't know what our resources are, our ability to justify that. I can't really see prioritizing a long-term care center in front of Boston Billiards, but at the same time, if we are able to meet a reasonable percentage of that need in the risk populations, maybe making sure that restaurants have easiest access possible to COVID vaccinations, and that maybe internally at least they're making sure they know who has those, might allow those restaurant owners to mitigate some of the risk, at least from an economic standpoint of, oops, we had St. Patrick's Day and now our our whole wait staff has COVID-19.
Thank you, Tom. Any further discussion? We're still with Stephanie and working with Jane, I believe, on coming up with a statement.
Well, I think that, no, I think that's a brilliant visual. And I think that's the messaging. And it sounds like there is a plan for that. So I'm very excited about it. I would just circle back to the Alderman Lopez's point about what we do about the curfew piece. And the question is, how do we meld that messaging with what we want to do with the curfew piece so that it doesn't continue to be a poison pill as has been described?
Tom?
I mean, in my opinion, I think leaving that resolution or that ordinance there is not helpful, and presenting something separate would probably be a better plan, because ordinances and resolutions aren't the same thing anyway. So we can make a statement on behalf of the city. We can accept a statement from the public health as a communication. I can read that statement in any form that you want, but I don't think we're talking about the same thing if we leave that resolution up there because, or that ordinance up there, because we're not going to be doing a curfew unless something ridiculous happens. And if that does happen, even then it's going to be easier to create new emergency legislation and get a second reading than it would be to try to pass something that the board has already decided they don't want to do.
Okay, so should we give, I haven't heard from Chuck. Chuck, any comments?
No, I think this transition from what we fought so hard from to then take it off the table seems frustrating, but I hear the poison pill discussion completely, because we want to be seen as advocates for everything that the aldermen do for us, and likewise us for them. So, but I also like the messaging that Tom had mentioned earlier about the mayor, if he could, say something that doesn't bind them up in a tizzy, but just say on behalf, or pivoting away from the curfew comment, continue to educate, continue to support, and all the things he just eloquently said. I too, anecdotally, I think the fear is, now that the vaccine's out there, I can't tell you in the last 2 weeks just in the clinical setting, every single patient I walk into now, and the door's closed. And as soon as I come in with my mask and shield, they're all scrambling to put their mask back up, as if that's, they're just now in their little cubicle and they forget that their outside world is still at risk, So I just proposed yesterday to all the primary care floors, just to say, can't we have another, and I think people are tired of signage, but, let's not forget that we're still in the midst of a pandemic, and do your part to help others. Wear your mask at all times when you're in the building and facilities. And except maybe when you're the privacy of your bathroom at home, you maybe can take it off, when you're in a public setting, we have to have it. So I think the education piece, I'm saying everything you've all said, response to recovery time we're moving into, but we can't forget where we've been.
Thank you, Chuck. Yes. Mr. Jetty. Sorry, Mr. Jetty.
Yeah, thank you. I was one of the aldermen who voted for the curfew. And then when after it was the motion for final passage failed, Alderman Clemens made a motion for indefinite postponement, and the thing about indefinite postponement is it carries with it the effect that that same ordinance or something very similar to it cannot be brought up again during the remainder of the aldermanic term, which goes until the end of this year now. So I argued against that. Because and a majority of the aldermen agreed that we did not want to put it in a position where we couldn't bring it back up if circumstances arose that convinced a majority of the aldermen that the curfew should be reimposed or imposed. So that, the motion to indefinitely postpone failed because a majority of the aldermen, agreed that they didn't want to take it completely off the table. There is an alternative. An ordinance can either be passed. Another alternative is it can be rejected. And the third is the indefinite postponement. We're just rejecting it, meaning that it doesn't pass, means that ordinance fails at that particular point in time, but it doesn't carry with it the extra effect of not being able to be brought up again during the term. So I'm wondering, whether what do you think would, from your point of view, what do you prefer? Do you, if it stays on the table as it is now, Alderman Lopez points out that he thinks it may be having a negative effect. On the other hand, it could be something that is there, and that people know that, if things get really bad, if they don't, it could be another incentive to for patrons of restaurants and the restaurants themselves to do what they can to make sure that the levels don't spike, that they continue to decrease, and that this ordinance could be taken off the table and enacted. Or if you're comfortable with the idea that we're never going to pass a curfew, then we could just outright reject it. And then if something terrible happens in the future, a similar ordinance could be reintroduced.
Stephanie.
Alderman Jettie, I really appreciate your thoughtful remarks. I am convinced after listening to this dialogue that it's a distraction. And it was crafted for a specific purpose at a specific time when certain environmental and geopolitical factors were in effect. Those are not in effect now. It does not mitigate that we need to do what we can to protect the community. But given what you've said, I think that we should send a message to the Board of Aldermen through you and Alderman Lopez that we recommend rejection because it does not fit our time at this time, that we continue to monitor the complex and changing situation. And at this time, we would like the focus to be on education. There are a number of aldermen that have newsletters that go out to other constituents, which I think is read by a lot of people. And perhaps the graphic that has been created for St. Patrick's Day and in anticipation of Mardi Gras and such should be shared with the board and ask them to distribute it to their constituents as appropriate.
Thank you, Stephanie. Any other comment? Tom?
For what it's worth, the mayor has the biggest email list of everybody, so definitely getting him on board would probably be helpful, which I don't think is going to be difficult. I think he may even have been in favor of the curfew initially, and then some other factors were taking place, but his comments in the original Board of Health meetings that he was attending were pretty much expressing, in my opinion, an understanding of what we were facing. But I mean, that horse has left the stable. So I think at this point, focusing on how we engage people in common goal is more important than how we try to restrict behaviors.
So Tom, excuse me. So Tom, I think timing is pretty important here. Instead of going to the Board of Aldermen right away and removing that legislation, do you feel that it would be more advantageous for us to come up with the global statement that we need, and at the time that's ready to be unveiled, remove that piece of legislation so that there's no vacuum in between?
I mean, I think that's a perspective. I don't really have an opinion on it, to be frank. If we remove it now and then we put the resolution in so that it has that timed effect in March before St. Patrick's Day, that seems like it would be the best bang for your buck. I think leaving it there only just so that we can make an impact is going to kind of blow up on our face. It's just sitting there for no reason, and it's going to look like we know that it's not going to go anywhere. We're just leaving it there. So I would just make the statement, period, that we think at this point the reasons behind it were more focused on the holiday season and reacting to those, and that given that there are some future potential super spreader events, we'd rather focus on community education and then use that as the platform for getting a resolution out just before St. Patrick's Day, that we're a city that is health conscious. We are focused on supporting the distribution of COVID vaccination, and that we think the best way to safely reopen is to focus on healthcare objectives and supporting community efforts to do that.
Okay. So do we have, Chuck?
Yeah, no, 100% agree with Stephanie's point that we pivoted, we need to do it. And thank you, Tom. I think that's great, what you just said too.
The only update I would have to the remarks, which I agree with, is I wasn't thinking about Mardi Gras. And Mardi Gras is next Tuesday. It's the 16th. So I don't know if there's a version of that St. Patty's thing that can be quickly tooled or distributed for Mardi Gras, but I don't see any problem with coming out with a monthly something or other based on what the drinking holiday or the gathering holiday is of the month.
Bob?
So you can kind of have the best of all worlds here, because you can send a communication to the Board of Aldermen before next week, which includes the graphic that you want to share and encourages aldermen to share it themselves through social media or newsletters or whatever. That won't be formally on the record until our next Board of Aldermen meeting, which is not next week, it's the week after. But it'll be read. It'll be an action item that can complement anything that public health is doing. And then at the meeting, we can pull off the tabled legislation. And there's still time to put that resolution in ahead of the St. Patrick's Day event. So I would just send a letter to the Board of Aldermen or some kind of communication on behalf of the Board of Health, just saying we support removing, and then let the aldermen take that action before the next meeting themselves independently, and then look at the formal steps being lined up with the meeting, because sometimes the meetings aren't the timeliness of meetings isn't going to fit like actual real world events. It's just our calendar, so there's no reason to try to work your messaging around that. Just do it different ways.
Okay. Any other comments or questions, directives? So Bobby, I think if I'm hearing Tom correctly, we want to communicate to the aldermen to remove that legislation. And in the meantime, Stephanie and Jane can work on a proposal for our universal cautions for the public that could be used in any type of situation. So we don't have to come back. We can just kind of pull that celebration out, put another celebration in, etc. Okay. Is that good? Chuck, I lost you.
Yeah, he has
Oh,
to
okay.
go.
No, that's good. I might just have to leave after this, if that's all right.
I just want to make sure all three of us are on the same page, so we give direction. Okay. Is that good with you, Steph?
Thank you.
Thank you. So let's go ahead and do that. My apologies to everybody else that had to listen through the quagmire of the politics part. Any other questions for the epidemiologist? Seeing none, I'd like to introduce my my new personal agent, Nicole. Are you out there? Nicole, you're up.
Here, everyone. So we just took a chunk out of my report, which will save some time. And I will make sure to send that flyer out to everybody after this meeting.
Thank you.
So specific to COVID-19, I continue to participate on the meetings with local partners, as well as co-lead our Joint Information Center by facilitating those meetings. We recently included our communications and marketing representatives from our local healthcare organizations on our joint information calls, just to coordinate and streamline vaccine messaging. We're working together to share resources, and we've also been able to invite some providers on our Public Health Matters TV show through those efforts as well. I continue to update our social media pages, website, and work with our public health strategists on our weekly newsletter. And I've also been assisting with contact monitoring, hotline calls, and working the COVID-19 testing clinics. And I just wanted to give you guys an update that we have been working really closely with our community health workers that we've hired. We've worked to develop resources on vaccine messaging that they can use within their communities. We've also worked on creating a brochure that we're going to be printing and flyers in 6 different languages, and we're going to be printing those for them as well. We're also working to film some short video PSAs about the vaccine. So we have partnered with some healthcare providers and community leaders from the BIPOC community in Nashua, and they'll be recording video PSAs on why they chose to get vaccinated and their vaccine experience. So our community health workers will also be filming some informational videos as well, and they'll be filming those in their first language and sharing within their communities. And I just wanted to mention, we do have some billboards and some bus advertisements about the vaccine on our radar as well. In regards to the community health assessment, as Angela mentioned, it was released for public comment yesterday. So we sent out a press release, we put a news flash on our website and social media posts on our Facebook and Twitter. We have received 1 comment so far, which is good, but that will be open for 2 weeks, and then we'll be publishing the CHA. And then I'm also going to include that in our weekly newsletter this Friday.
Very good.
And then I did want to mention that Public Health Week is coming up April 5th to April 11th. So this year's theme focuses on building connections within the community. Internally, we had our first planning meeting on January 27th. And I am working on sending an invitation to our regional partners to encourage them to get involved. And then we're still planning, but internally we'll be participating safely this year. We're going to be hosting a walking challenge, promoting public health education on our website, social media, and through some virtual events. We're planning to write a news article and also film a video about why public health matters to promote our services. And then I'm hoping to set up some outreach tables within the community as well. And then other business, as Bobby mentioned, we did have our Mayor's Opioid Task Force Legislative Breakfast on January 29th. That was a great success. We did hold it virtually through GoToWebinar, and it focused on building resilience using a COVID-19 lens. We did have a total of 53 attendees, and I just wanted to let you guys know that it is available on our YouTube page and website if anybody's interested in watching the recording. And then I guess just as Flavia mentioned, we've also been promoting our weekly STD clinics as our annual Valentine event this year. And folks who attend those will receive a goodie bag and a gift card. So I've been promoting a flyer for that throughout the community and through community partners. And that's my update.
Very good. I'd like to say I got that email about the community health assessment and went on and started diving in and realized I needed more time. There's a lot of information there, a lot of hard work too as well. So thank you, Nicole. Any other questions for Nicole, comments? Seeing none, kind of going back to environmental health, anything else that you wanted to bring up, Heidi or Ren?
Can you guys hear me? My connection's a little loopy here. Okay,
Yeah,
good. Most of our report has been covered. We are committed to, well, we learned a lot during COVID and learned what works and what doesn't. And so we know that our strongest asset is the relationship that we have with our food service partners. And so we are trying to educate to the best of our abilities based on, with a COVID lens in mind now. And we know that there are some things that are coming up, such as, the warmer weather, drinking occasions, certainly, but we also are getting ready for outdoor dining. And there are a lot of things that we do routinely throughout the year, some efforts, but those, we're fine tuning some of those so that they are more focused on both drinking and COVID related. But it's in the report. It's there's nothing else that people haven't mentioned previously. Our report echoes a lot of what Bobby had said and certainly what Community Health had said.
Thank you, Heidi. Ren, you good?
And if I can just add one little thing, I think ties in nicely. Actually, something that happened this morning with like restaurant, and ties into the fact that we need to remind people that we're still in the midst of this, and that even the hardest shell can actually crack. Is that we were doing some routine work at a establishment I will not name. That historically we were out there many times for a complaint of them not following the COVID rules, and through that whole system of verbal warnings, written warnings, a citation through the police department, a fine that we worked with through the AG's office when we went there for our routine visit this morning. Masks were on. They were very thankful that our staff was there for the work that we were doing, and at the end of it, he actually looked at one of our staff, Mike, who had been out there during the early phases when we were out there a lot. And he said, you know what, when you were out here previously and I was asking you, well, why do I have to wear masks? Why do I have to do all these things? What's the science? He says, within a couple hours, you were back in the office and you sent me everything that I had asked for. And I thank you for that. And so I think that really shows the impact that our staff has when we are out there constantly making sure that people understand why we are doing what we're doing, and how even the people who want to resist most can actually change. And I think that I just wanted to share that. So thank you.
That's awesome.
Any questions, Stephanie? You're good? I'd like to move on, if it's possible, to Mr. Mack. Bob, you're up.
Good afternoon. Bob Mack, Welfare Officer for the city. Briefly review of the monthly report for the Welfare Department. You can see a slight increase in shelter expenditures as compared to last year. The department has focused, as it normally does, on eviction prevention, particularly during this time. Keeping people housed is definitely more cost effective than trying to rehouse people that have been evicted. We are finding a number of folks that are multiple months behind. Part of that is, I think, an unintended consequence of some eviction moratorium programs. But we have gotten some messaging out as well. We were working with Nicole and some of our community partners to make sure that people were aware of the programs available in their community to get rental assistance to avoid eviction. Part of the extended moratorium through the CDC requires that tenants be seeking assistance in order to prevent any sort of eviction action. So it's not just a matter of, I don't have to pay my rent and I won't get evicted. So again, we push that messaging out again, as we had early on in this pandemic. We are still waiting on the state to determine what they may do with some additional rental and eviction prevention funding that is supposed to be coming down from the feds. So we're staying tuned on that. And Director Bagley had mentioned the warming stations. That is an ongoing conversation, as she had said. We had a meeting this morning, and I have been in communication with some of the shelter providers, and I'm looking to coordinate a meeting and a conversation with some of the key stakeholders so that we can look to address this issue in our community for some of our more vulnerable folks. And at this point, that's all I have, unless there are any questions.
Thank you, Bob. Any questions, Stephanie? Looking good. I'm hoping everybody's had a chance to say what they had to say. If I missed anybody, I'm sorry, because of the setup. That being said, are there any public comments? Any public out there that have any comments or questions or concerns or good jokes? Anything? Seeing none, I'm looking for a motion to adjourn, but after using the chair privilege, happy Valentine's weekends to everybody. Have fun. Be safe.
Thank
Those
you.
in favor, you're welcome. Those in favor of adjourning, we are adjourned. Thank you.